Welcome to the Nursing Edge podcast. I am Dr. Milady Mortimer Ragu. I am a daughter. I am a wife. I am a mom and a friend. I'm also a nursing professor at Family Practice Doctors. I am a co-owner of Family Practice Doctors as well as Family First Doctors Urgent Care and many other ventures. And I'm also a preceptor for many universities such as Walden University, Chamberlain University, George Washington University, and many others where I precepted students for the last 15 years. So let's get started on to our next podcast here, really focusing on the show must go on. The show must go on. What do we mean by that? Well, if you are new here, please check back on my last podcast. I would say the last 7 podcasts, which really talk about how we get started in nursing. If you are interested in nursing, to go through the anxieties of getting started something new. And at this point right now, we'd like to go on and discuss the show must go on. And what do I mean by that? When you are already in nursing school and you are excited, and well, boy, was I excited when I got started. I think every single person in my family knew I got into nursing school. And I am an alumnus of Southern Connecticut State University. That's where I started in Connecticut. And it was just amazing times, but also stressful because you are not quite sure what to expect when you are in nursing school. And it's so different from everything else that we've been taught. Any other class that you've taken, I mean, I could say some of the health allied sciences are similar to nursing, but not exactly. So let's get a little bit more relaxed here. I find that I get a little more into it when I am teaching versus my usual everyday videos. So you get in, you finally, starts to take your exams and you start to realize that this is very different. One of the things I've heard recently around here in some of the universities and colleges that they are actually doing teaching the methods of taking exams in nursing. That is brilliant. When I tell you, I think that's what was missing back in the day, where there is a little bit of it that is taught at the beginning, but as you are going through, it's almost like you want every exam that you take to also mirror it. And although, thinking back, the exams did mirror the NCLEX, but when you go back after you've taken your exam and you go back and you're like, oh my gosh, I didn't do so well. There was not really that coaching there. And, everybody's busy. I'm not trying to blame anybody, but there's not that support there in case you did not do well. So that is what I am bringing you here on this podcast. The support to go through when things are not going that great, when you are struggling, when you are finding it difficult to get to the next level in terms of the next class. So when you've taken an exam, and depending on the universities, it may be a 75 or above, and some may be an 80 or above. Average is about 75. Again, you would have to make sure to check with the university that you're applying to be sure what the passing grade is. That's something that you're going to, is a standard that we always need to know and be aware of. So let's say you get a 73. Lord Jesus, only 2 points to make it, right? And it's so frustrating because you put your all in all to be able to pass this exam. So what do you do next? You start to panic. And that's what happens to most of us. We start to panic. I'm trying to adjust the camera here, moved a little bit. You start to panic and you're thinking to yourself, okay, what do I do? That's just an exam. So of course you need to get to the end before they say, okay, what happens next? So the next exam, you got a 73 on the first one. The second one, it just so happens you scored a 70. So again, more panic sets in, and you start to think about, okay, what if I get kicked out? Because what happens in most nursing schools, you fail an exam is one thing. They're gonna, you go to the professor, you try to, of course you should, right? Go to the professor to try to find out how you can get more help. What are the things you can do to improve your grade? It's not like in high school where you get extra credit. Very few of them do have that, but typically not. So you go to them for help, and then they provide the help that they can, and during the office times that they have. You go back home, you try to regroup, and if you recall from the previous podcast when we talked about how to survive through study groups, through doing flashcards, different tips to be able to survive and study more effectively, okay, more efficiently. So you go back and you do all that, and then you kind of ask your friends, how did you do in the exam? And they're saying that, okay, they did great. So it's very difficult not to get into your head where, okay, everybody's doing well and you're the only one who's not doing well. No. I urge you to keep plugging. Focus on you. Everybody learns differently. This may be the course that really took you for a loop, which, many different courses may do that, various different things in life. It may be a learning style issue. Find out why you are getting the low grade. And if you really analyze your tests, you will see, okay, it seems like every question pertaining to this topic seems to be what I'm getting wrong. Or I would have done better, but I erased. Let me remind y'all of something. Please, when you start, there's something about the brain that remembers the primary thing that it recognized first. So trust your brain to know that it knows that you saw this answer somewhere in your subconscious. It is there. And what you spot to be the correct answer, pick it and do not erase. I think the number one thing that I see in terms of students not passing is because they second guess themselves. Trust yourself. Trust the knowledge that you have obtained. Trust the information that your brain has stored, and it knows how to store it. So try not to erase once you've gotten the answer. And again, another tip that I'm going to throw out there, and I will teach more about test taking in the courses that are coming up. When you are focusing on a question, the questions, the way they word them, it may be that there's only one right answer, but what is the best answer out of the 5? So the first one, A, is going to have something right and 2 things wrong, possibly, right? I'm just kind of hypothetically throwing that out there. Answer B is mostly wrong, but probably one part of it is right. And then let's say C is half right, half wrong. And then D, possibly the right answer. You're not entirely sure. Do a process of elimination if you're not sure any part of the answer that is wrong makes it wrong. Do not justify it, people. Oh my goodness, I've seen this a lot. Do not think about overthinking the question. Yes, it is a higher level thinking question. Most of them are. That's what nursing is all about. A, B, C, right? What's going to kill the patient if you don't do it, right? So these higher level thinking questions, you need to make sure to eliminate the bad. right away, like, A was wrong, B was wrong, and C, potential, put a question mark next to that. And now D, I'm thinking that this may be the answer. If A, B, C are wrong, the only thing you have left is D. People, move on with D and move on to the next question, okay? Because time is clocking. We need to make sure that we have had enough time to answer the rest. And before I forget, read the question twice. The first time you read it, you kind of skim. The second time, you're like, what is the question really asking me? Is somebody trying to throw me off track? Did they throw in a caveat on purpose? Or these are like extraneous facts, but really the question is asking me for this. So again, in our courses, these are the things that I teach you. How to take these exams, especially the course for NCLEX prep, as well as the nurse practitioner exam, identifying the most important thing from the question. I also have devised my own questions outside of the questions that you will see on NCLEX. My questions are based on clinical practice, the last 18 years of practicing as a nurse practitioner, and also for those who are prepping for NCLEX for the nursing exam, my experiences in hospital, outpatient, in various, like even the health department, things like where nurses do work in health departments and various outpatient settings. Questions of coming from, I also work as a nurse who is a visiting nurse, so who comes in your home. So I have quite a bit of experience in various aspects of nursing to be able to guide you and provide you real life experiences to help you. So getting back to, okay, you've taken the test, and the first test was a 73. The next one is a 70. Now, let's say they only allow with your care plans, whatever it may be, you have 4 exams, let's say, hypothetically speaking, y'all, don't slam on me in case there's more. So let's say there's 4 exams for the semester for this class, and you have failed the third, you got a 69. So looking at your average, it's not looking very good, right? And now you have the final coming up. It's not impossible, but depending on how much they weigh, you're likely not going to make it on the final. So now the final comes, you get a 74 on the final, but not enough to pull you through because the other grades were under the 75 cutoff. Now, the feeling of doom comes in. Do not despair, y'all. Do not despair. Now you have a meeting with your nursing faculty and they say, I'm sorry, you did not make the cut for that particular class. And what does that mean for you? It's going to mean that you have to drop out of the program. Y'all, I can only imagine when someone has heard that, how devastating. You have put your life into studying. It was not easy for you. Let's say the situation was that you have 2 kids that you're trying to get to daycare every morning, various different things in your life. You're caring for an older parent. You have a sibling that who requires a lot of support, whether it is someone with special needs. So now you're trying to figure out, what do I do now? Do not, no matter what you decide, I urge you, don't give up. This school will not necessarily tell you, well, if you have failed that class, you have to start the program all over again. So wherever you were in the program, you have to start over. But they are not going to urge you to go somewhere else. Listen, people, look at your credits. Go on these lovely internet. Go through different schools in your area. And many of these schools are online, okay? Go through and see the credits that you've already taken, the prerequisite should still apply for most schools. Go ahead and, compare and see where else you can transfer these credits and start at another school. Listen, y'all, you're not the first and you're not the last. You're not the first to fail out and you're not the last, right? So we're going to continue on and do this thing because we have a burning desire to become a nurse. So we're going to go ahead and knock this thing out no matter what anybody says to you. I know it's going to take some time. You're going to do the sulking. We all have to do it. But listen, put your granny panties on and let's do what we got to do. Get your information through various different schools and get your transcript together. And that class that you didn't pass, now this is the class that you're going to need to focus on. Whatever tutoring help, again, some of the things that I provide on this platform, support for specific classes to help you. So do what you need to do so that the next time you do not come so close to failing a class where you're getting the anxieties of like, oh, here we go again. So that would be my advice to you. There are many, many universities around. I cannot call out any specific ones because before somebody come after me and say that I'm promoting any specific university, try and figure out where you can go to get things done. Okay? So besides that, many other schools are maybe, not to say their classes are different, the teaching is different. They may provide more support, more resources for the classes that you would have issues with, or the one you had difficulty with. One of the primary classes I know that trip up people, because boy, it was a doozy for me, y'all. It was a doozy in nursing school, was a doozy in graduate school. It was a doozy during my doctoral degree. Research. Why? Some of us may do very well. I'm not saying all of us won't. Most of us historically do not do very well during research because it's very specific language. It is specific language that is not very easy to understand. So one of the reasons why that we find it very difficult. And then, the math and analyses that come with it can be very cumbersome. So you really either get some help from somebody who's already done it, especially statistics, y'all. Yeah, it's coming back. It's coming back. Yeah. Statistics threw me for a loop. Let's put it that way. But I have someone in my house who was very good at that stuff. My husband was extremely, extremely good at numbers. And I have my big sister friend who made the difficult specific topics make sense to me, was able to break it down, spend some time with it. Remember, I talked to y'all about the village. You must have the village. Have people around you who can help you. If you don't know anybody, listen, what is this big Facebook, internet, You can send somebody a DM and say, listen, do you know anybody? Put a post out there. Anybody can help me. They have tutors online. I use tutors from various platforms like Wyzant. There's a tutor for everything. So when we need to get through, we need to get through. Sometimes it does cost a little bit. But again, to get through this stage in your life, to get to the next, it requires dedication. It requires some money, requires time, and some tears at times. So we keep plugging, right? Okay, so we talked about getting some help with research. The worst thing that can happen, again, is failing, but it's not the worst thing that can happen. The worst thing I think that can happen is you completely dropping the program and giving up. To me, that is the worst thing anybody can do. Because while you're in the mode of studying and you're in the mode of being a student, that is the time to get back on the saddle and do your thing. So you don't want to wait a year, take, a year break and a semester break, not doing anything. Listen, while you have this momentum of being a student and you have gotten this far and learned how to get from point A to point B in terms of studying, keep going. Don't wait. Get it all together and do what you need to do with the next school. Most people, I would say, I'd like to see the numbers on that. If anybody has it, please put it in the comments. I'd love to hear from you. If you had a situation similar to this where you were going, everything was going on well, and you failed a class and you had to transfer out of the program to another program. We'd love to hear from those nurses. Many people have had this story, but nobody needs to know at the end. I mean, if they decide to share with you, great. But many people have had instances where they didn't pass. But does it really matter? If you have to take a test, let's say the NCLEX, for instance, and you finish out, you take the NCLEX and you didn't pass, does anybody need to know your business? Like Tabitha Brown says, it's your business, okay? So if you decide to share with somebody, that is all on you. You can wait, take 4 weeks, 6 weeks study, and I recommend my NCLEX prep is a 4-week study course so that it gives you enough time to absorb what you need to absorb and also time to ask questions and come back and weekly and hit it again until it becomes repetitious and you spit it out like water. Okay, so again, it's not about not passing, it's about what do you do with that. How do you move forward and knock it out the park? That's what it's all about. At the end of the day, we have a goal and we're going to do what we need to do to reach it. So that's basically all I wanted to share with you this fine evening. And I want to encourage you, again, my goal for doing this is to provide you with the necessary resources to excel, well, back up, to start, to stay in the program, to excel in the program, to graduate and then get your license. And ultimately, once you've gotten your license, you start your first job, how to survive that first job, which will lead us to our next podcast. We look forward to seeing you soon. I hope you guys gain some knowledge from this podcast, and I'd love to hear from you guys. Again, I'm Dr. Milady. Thank you.